Hello, and welcome to Med for Care. I am Dr. Care, and today's topic will be nausea and vomit. By vomit, or emesis, we mean the expulsion of gastric contents in a retrograde direction, that is, from the body towards the outside, thanks to the contraction of the diaphragm and abdominal muscles. On the other hand, nausea is identified with the unpleasant sensation that often precedes vomit, although it is not necessarily accompanied by the emission of a food bolus from the mouth. Both are very common symptoms. In fact, a study from the 1990s showed that half of the population used as a sample reported suffering from nausea during that year. The incidence of vomit, on the other hand, stood at 30%. Symptoms typically associated with nausea and vomit are drooling. Example, excessive saliva production, profuse sweating, fever, nasal congestion, headache, generalized asthenia, migraine with aura, pale skin, diarrhea, abdominal cramps, tachycardia, and reflex increase in blood pressure sanguine. The activation and regulation of vomit are carried out by the so-called vomit center, located in a dispersed manner in the brain, in particular in the brainstem, in some nuclei of the reticular formation and in the solitary tract. In this center, signals from chemoreceptors located both at the gastrointestinal and cerebral levels converge. The outgoing response, called efferent, consists in the translation of the gag reflex into motor action through the vagus nerve. This action is generated by the involuntary contraction of the muscles of the esophagus and stomach. This is also possible thanks to other brain nerves, such as the trigeminal nerve and the glossopharyngeal nerve. Some aspects of the mechanism of vomit are also found in that of nausea. However, sometimes it can originate from different stimulations, such as excessive static function of the stomach, known as gastroparesis. In addition, while vomit consists in the actual expulsion of gastric material, nausea involves only malaise and discomfort located especially in the upper portion of the stomach. One of the most common triggers is the so-called motion sickness. It is a condition linked to the movement of a means of transport, such as car, train, or ship. The feeling of discomfort felt is caused by the fact that the brain receives conflicting signals from the visual system, on the other hand, and from the vestibular system of the inner ear on the other. For this reason, therapy in these cases is primarily aimed at attenuating these conflicting sensory inputs directed to the brain. Severe episodes of nausea and vomit can also be caused by many chemotherapeutic agents used in cancer therapy. First of all, platinum-based compounds. Indeed, they cause a cytotoxic action at the level of the gastrointestinal tract, activating local chemoreceptors and directly stimulating the vomit center. Most patients undergoing radiation treatment also complain of nausea and vomit as side effects. It is also very common to experience nausea and vomit after surgery conducted under general anesthesia, especially when given strong opioid drugs such as morphine and fentanyl. Some inhalations anesthetics such as halothane, isoflurane, and nitrous oxide also seem to be involved in the nausea and vomit reflex. Finally, numerous pathogenic microorganisms can also be at the root. In particular, Staphylococcus aureus and Bacillus cereus are particularly noteworthy. Among bacteria and rotaviruses, among viruses is the main responsible for inducing vomit. In most cases, nausea and vomit arise as a result of sporadic stimuli and resolve spontaneously. However, If they persist over time, it is first of all necessary to correct consequent conditions such as dehydration and malnutrition, and secondly, to carry out specific laboratory tests. In particular, blood tests are often prescribed. They include, in addition to the blood count, also the dosage of electrolytes, liver function markers, pancreatic enzymes, and for women, even the pregnancy test. If intestinal obstruction is suspected, the doctor often also requests instrumental tests such as direct radiography of the abdomen with birate contrast, medium, and abdominal CT. On the other hand, esophagogastroduodenoscopy is the most suitable examination to assess the health of the esophageal, gastric, and duodenal mucosa. The pharmacological management of nausea and vomit is very complex because it must distinguish between acute and chronic conditions and also consider the different responsiveness to drugs depending on the underlying causes. In general, the drugs most commonly administered in antiemetic therapies are antagonists of serotonin 5-HT3, which act effectively in post-operative vomit, chemotherapy-related emesis and gastroparesis, antihistamines, especially for labyrinthitis and motion sickness, phenothiazines, which have antidopaminergic activity on the centers of stem brain vomit, benzodiazepines, especially useful for alleviating the anticipatory symptoms of nausea, corticosteroids, often used in combination with anti-5-HT3 drugs in case of post-operative vomit. In conclusion, we can underline how the global diagnostic classification of nausea and vomit is particularly complicated. However, it is always advisable not to underestimate repeated and persistent episodes to prevent possible serious complications such as dehydration, metabolic alkalosis, and hypokalemia. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med for Care.